focus on is primary dysmenorrhea is generally pain during menstrual bleeding in the absence of any obvious pathology or known pathology. Okay, what a pathology is something that's inherently wrong with the uterus or ovaries or the general pelvic system. Yeah. Now, secondary dysmenorrhea is pain which could be attributed to a pathology such as endometriosis, adenomyosis, yeah, or any pelvic inflammatory disease or infection that's ongoing at the time in the uterus. Okay, the age is a useful distinction. Generally, primary dysmenorrhea happens when a woman attains her period for the first time at menarche. Okay, and between 16 to 25 years. Not to say that someone before 16 can't experience the pain, or somebody after the age of 25 cannot experience the pain. Secondary dysmenorrhea, as I said, is due to a pathology. We generally see it in age group between 30 to 45 years. Yeah. Then moving on to onset. As I said, after menarche for secondary and primary at the age. And the duration is generally only during a period is when primary dysmenorrhea takes place, whereas secondary dysmenorrhea will have abnormal variations throughout the cycle. It could be associated with abnormal bowel and bladder habits, that is, irritable bowel syndrome, diarrhea, vomiting, etc. Okay. Having said that, primary dysmenorrhea does present with some amount of nausea and vomiting. I'll explain more on the next slide. May I have it, please? Yeah. So how we go about distinguishing primary and secondary dysmenorrhea from a gynecological perspective is, the first thing is a very thorough history. History goes a long way, especially in terms of period pain. The fact is that diseases such as endometriosis go as well as 7 to 10 years not being diagnosed, because women do not feel like, pain is normalized. They do not feel that they need to go in with this issue. Okay, so a very thorough history, and a patient can help tell us this, is the first thing. Okay, and a period diary, recent studies have showed that a period diary will really help distinguish between endometriosis and adenomyosis, or if it could just be primary dysmenorrhea. Yeah, so typically primary dysmenorrhea presents as a cramping type pain. It radiates to the back and to the legs. Okay, and as I said, it can also present with nausea or vomiting. Generally, it is indicative of an ovulatory cycle, because when the egg is released, there's a little bit of corpus luteum. That remnant is called the corpus luteum. That secretes a hormone called progesterone, and progesterone goes and activates this pain pathway that releases arachidonic acid. Okay, so when this acid is released, this is what causes the cramping and the pain that is seen every month. Yeah, which is why we target painkillers that go block the pathway, that help in terms of primary dysmenorrhea. Now, secondary dysmenorrhea, there's a wide plethora of symptoms it could present with. The first is painful sex. Okay, it can be distinguished from vaginismus because painful sex on penetration is more typical of an endometrial, of some pathology in the pelvis. Okay, any abnormal vaginal discharge, because we want to rule out any underlying inflammation or infection. Okay, and chronic pelvic pain, which is pain, the definition is a little bit vague, but generally we say pain that lasts 3 to 6 months and not only associated with the period. That is, the patient can present with it at other times. Okay, also associated bowel and bladder symptoms like irritable bowel syndrome and painful dysuria. With these symptoms, physiotherapy also we find really helps. Okay, then moving on to clinical examination, your gynecologist will do an internal examination. Okay, and typically, if we can rule out a fixed uterus or some nodules, sometimes there'll be palpable rectal nodules or enlarged and tender ovaries. All of these will help us rule out conditions like endometriosis, and an enlarged uterus can help us rule out adenomyosis. So a clinical examination does tell us quite a bit. A normal uterus is more indicative of primary dysmenorrhea. And then we go in for ultrasound examination. Again, sometimes endometriosis is not always picked up on ultrasound, but it is useful in picking up, any obvious ovarian endometriosis, which is endometrioma, which occurs in about almost 44% of patients. Yeah, and it can also rule out some obvious nodules, etc. Okay, so that's about it for me in terms of period pain, investigations, and diagnosis. More, of course, questions will be answered. Thank you, Aisha. So going on to endometriosis. Now, what is endometriosis? It is a disease in which the tissue, as you can see, lining the uterus, it grows outside to the uterus. It grows outside of the uterus. It can cause severe pain in the pelvis, and of course, make it harder to get pregnant. Okay, causing subfertility. As I mentioned, delay in seeking pain, because normalizing period pain is it does take place, and endometriosis can occur anywhere between 10 to 20% of the population. May I have the next slide, please? So how we treat endometriosis, a common thing is painkillers, okay, hormone therapy like birth control and gonadotropin releasing hormone. More, of course, on all of these therapies like hormone therapy may prevent somebody from getting pregnant immediately. So in that case, after the cycle, we encourage patients to get pregnant. Okay, progestins we use and aromatase inhibitor. Now, surgery earlier was the gold standard for diagnosing endometriosis. However, now we do what is called empirical treatment. That is, if we suspect endometriosis, we go ahead and give the patient a cycle of hormone therapy or progestins. Okay. And if it responds, then well and good, we move on with the thing. If not, we do ask them to undergo a laparoscopy, which is a small keyhole surgery where we put in a camera and visualize the pelvis. And if there is any obvious endometriosis, we go ahead and treat it surgically. Okay. Symptoms have shown that 67%, studies have shown 67% of patients do have improved symptoms, but there is, however, a 33% relapse for surgery. So now we try to treat that with post-surgical therapy, okay? More alternative methods are immunomodulators, vitamin D3, and of course, pelvic floor physiotherapy, which helps us especially treat all of the symptoms of endometriosis like painful period, painful sex, pelvic floor pain, and dysuria, okay? And sometimes constipation as well. Moving on to the next slide, please. So if painful periods are being experienced, a gynecologist can always help you manage painful periods and refer to a physiotherapist who can help you manage your painful intercourse, pelvic and abdominal pain, a painful period, constipation, and of course, help in the recovery of endometrial surgery. Okay, we can help guide you towards an apt treatment, and each treatment I want to say is individualized and tailor-made to each patient. No two patients can be the same. A lot of things that are taken into perspective if the patient is keen on conceiving, or if they have completed their family, in which case there could be more mainstay treatments such as hysterectomy. Yeah, that's it for now from me. Moving on to Dr. Anuja. Thank you.
Thanks so much, Dr. Annanya. And I think, everything you said is completely relevant. And this is why I love working at Proactive, because we get to really collaborate with our gynacs and our mental health therapists and our nutritionists. So it becomes a really great experience for the patient as well. So I'm going to talk a little bit about why physio can help with pain, because I think that's not something that always comes to somebody's mind when they're in pain or they're dealing with any kind of chronic pain. They don't necessarily always think like, oh, I should go to a physio, or especially a pelvic health physio, to address some of these concerns. But what I'm here to say is that we're actually the experts at doing this. And like Dr. Annanya said, we're one of the people, one of those treatment methods that can really help to manage your symptoms. Of course, it's not going to take away any kind of, endometriosis or any kind of pathological condition that's creating this pain. But what we can do is help you to manage it so that it really improves your quality of life. So just to kind of understand pain, that's usually the first step in all of this. And when we talk about pain, right, there are multiple factors that can affect our pain. So first, it's biological, right? We have some kind of injury or inflammation or pathology, right? So whether that's like your menstrual cycle that's going on, and like Dr. Annanya explained, right, there's a reason why we're experiencing pain during our menstrual cycles, or if you have endometriosis or adenomyosis. But there are also social factors like your work, your family, your relationships, what's going on in your life. A lot of those things can contribute to how much pain you're experiencing. And then you also have psychological factors like how your mental health is, what are your stress levels in general, not just during that time, but throughout the month as well. And all of that can affect how much pain you experience. So what happens is, like, when you're experiencing pain, right, these signals are especially like, let's say if you're experiencing pain during your menstrual cycle and it's happening like every single month, right, signals are sent to your brain, and it increases the sensitivity of the nerves just around your pelvis, around your abdomen, around your uterus, so that your brain starts to interpret any kind of signal as pain, right? It doesn't necessarily have to be the signal that is the painful one, but anything that's happening, it starts to interpret as pain. And this is what we call turns on your fight or flight response, right? So when you're experiencing that pain, your immediate reaction is like, I need to either get away from this pain or I want to fight the pain. Okay. And what we know from research is that movement is actually known to help manage this pain and help you start what we call your rest and digest system. And that's what we want to lean towards when you're experiencing this pain so that those signals quieten down. And I'll talk a little bit more about this. So the reason why we say physio is really helpful, especially pelvic health physio, is because we're experts at understanding this pelvic pain and helping you manage it. And like I said, there are other factors that are affecting your pain, right? It's not just these biological factors. So we're at Proactive, we really want to make sure we're addressing the other parts of your life that could be contributing to your pain. Because if we're only focused on addressing the biological aspect, it is less likelihood that we can completely help you manage it. All right. Go ahead to the next slide, Aisha. Okay, so there are multiple strategies, and these are just a few basic ones that I want you to be able to like take away, and even try at home after this talk, is just to help you manage the pain, right? So the focus is to, like I said, we want to help you relax, quieten down your system so that we help to decrease those pain signals or at least change them so they're not necessarily interpreting them as pain always. Okay, so that